You've probably been told this before. If a doctor prescribes a medication, it's safe. I believed that too, for a long time. Until I started seeing the same patients come back to my operating table. Heart attacks, strokes, cardiac arrest. Men and women in their 60s and 70s who were doing everything right. They took their pills every morning. They followed instructions. They trusted the system. And every time, the same medications were sitting in their daily pill organizer. My name is Dr. Michael Carter. I am a cardiothoracic surgeon. I have spent over 20 years operating on hearts that were never supposed to fail. Today, I want to talk to you about 5 common medications that significantly increase the risk of heart attack and stroke in people over 60. This is not about scaring you. This is about giving you information your doctor may not have time to explain. Because knowledge can literally save your life. Here's what most people don't realize. When a drug is approved, it is mostly tested on younger adults, healthy people, in their 30s or 40s, usually with just one condition, no other medications, and a liver that processes everything efficiently. But that's not you. And that's not most of my patients. By the time you reach 60, your body handles medications very differently. Your kidneys filter more slowly. Your liver breaks down drugs at a reduced rate. What a 50-year-old can tolerate without a second thought can push a 70-year-old into a cardiac emergency. Does that surprise you? It surprises most people when I tell them. Here's something else. The average American over 65 takes 4 to 5 prescription medications every single day. Some take 8. Some take 10. Each one was likely prescribed for a valid reason: high blood pressure, arthritis, depression, allergies, diabetes. But here's the uncomfortable truth. Most of these drug combinations were never tested together. And in an aging body, the interactions between them can become unpredictable and sometimes dangerous. I'm not saying your doctor made a mistake. I'm saying the system was never designed with your specific situation in mind. And that gap between what is prescribed correctly and what is actually safe for you, that's where heart emergencies hide. So let's talk about the first medication I most often see linked to heart attacks and strokes in older patients. Pill number 1. The painkiller that hurts your heart. NSAIDs, non-steroidal anti-inflammatory drugs. Ibuprofen, naproxen, diclofenac. Most of them are available over the counter. And that's exactly what makes them so dangerous. When you're 65, your knees hurt. Your back aches. Reaching for ibuprofen feels like the obvious solution. Harmless, right? It's sold without a prescription. It's been around for decades. But here's what's actually happening inside your body when you take it regularly. These drugs cause your body to retain sodium and water. That raises your blood pressure. And in an older heart that is already working harder than it used to, increased pressure is like adding weight to an overheated engine. But that's not all. NSAIDs also interfere with the protective lining of your blood vessels. They make your platelets stickier, more likely to clump together, more likely to form a clot. And a clot in a coronary artery is a heart attack. A clot in a brain artery is a stroke. Studies show that regular NSAID use in people over 65 can increase the risk of heart attack by up to 50%. That is not a small number. So what should you do if you're in pain? Talk to your doctor about alternatives like acetaminophen. It's generally gentler on the cardiovascular system. Physical therapy, topical treatments, lifestyle changes. Real solutions exist. Pain relief should never come at the cost of your heart. Pill number 2. diabetes medications, with a hidden risk to your heart. An older class of diabetes drugs called sulfonylureas, medications like glipizide, gliburide, glimepiride. These drugs work by forcing your pancreas to release more insulin. That sounds reasonable. But here's the problem. They do this whether your blood sugar is high or not, which means they can push your blood sugar too low. This is called hypoglycemia. In a younger person, low blood sugar feels uncomfortable. Shaking, sweating, dizziness. You eat something and it passes. But in someone over 65, hypoglycemia can trigger cardiac arrhythmia, irregular heartbeat. And in a heart that is already vulnerable, that irregular rhythm can turn into something much more serious. And here's what truly concerns me. Many older patients don't feel the classic warning signs anymore. That internal alarm system gets weaker with age. They can walk around with dangerously low glucose levels, while their heart is paying the price, without them even knowing it. If you or someone you love is taking diabetes medication, ask your doctor a very specific question. What is my risk of hypoglycemia? Because newer medications, like SGLT2 inhibitors, have actually been shown to provide cardiovascular benefits. Better options exist today. You just have to know what to ask for. Pill number 3, the antidepressant, your heart never agreed to. This is harder to talk about, because depression in older adults is real. It's serious, and these medications help millions of people. I want to be very clear about that. But there is a category of antidepressants that deserves a serious conversation. Tricyclic antidepressants, TCAs. Medications like amitriptyline, nortriptyline, doxepin. They've been around since the 1950s, and in some cases, they are still prescribed today. For depression, for nerve pain, sometimes even for sleep. But here's what they do to your heart. TCAs interfere with your heart's electrical system, the system that controls your heartbeat. In a young, healthy heart, the body can often compensate. But in an older heart, this interference can cause something called QT prolongation, a disruption in the heart's electrical rhythm that can lead to a dangerous arrhythmia, called torsade de pointe. It's a French term. It means twisting of the points. It describes how the heartbeat looks on an ECG when it becomes dangerously unstable. And it can lead to sudden cardiac arrest. Now here's something many people don't realize. Even some newer antidepressants, like certain SSRIs, can carry cardiovascular risk in older patients. For example, citalopram has been shown to affect heart rhythm at higher doses. I am not telling you to stop your antidepressant. Please don't do that without speaking to your doctor. What I am saying is this. If you are over 60 and taking any antidepressant, ask for a baseline ECG. A simple test, takes 5 minutes, but it can tell you everything you need to know about how your heart is handling that medication. That one conversation could save your life. Pill number 4, a common allergy medication with a surprisingly dark side. Quick question. Do you keep antihistamines in your medicine cabinet? Most people do. Diphenhydramine, the active ingredient in Benadryl, and many over-the-counter sleep aids. These are first-generation antihistamines. They've been around for a long time. And because of that, most people assume they're completely harmless. They're not. Not for everyone, and especially not for people over 60. First-generation antihistamines also affect the heart's electrical system. Just like the TCAs we talked about, they can prolong the QT interval. And when you combine them with other medications that do the same thing, the risk doesn't just increase, it multiplies. Antidepressants, certain antibiotics, some antifungal medications, When combined with antihistamines, this becomes a much more dangerous mix. But there's more. Diphenhydramine also blocks a key neurotransmitter that helps regulate heart rate. In older patients, this can lead to rapid heartbeat irregular rhythm, especially at night when the body is already in a more vulnerable state. And here's the part that really concerns me. Diphenhydramine is often used as a sleep aid. People take it because they can't sleep, and it ends up stressing the very organ they're trying to let rest. The good news? Second-generation antihistamines like loratadine or cetirizine do not interfere with the heart in the same way. Same allergy relief without the same cardiac risk. A small switch can make a very big difference. Pill number 5. The cold medicine that can quietly raise your blood pressure. I want you to think back to the last time you had a blocked nose. What did you reach for? Most likely something containing pseudoephedrine or phenylephrine, Dayquil, Sudafed, many cold and flu combinations. For a healthy 40-year-old, they usually work just fine. But here's what these decongestants actually do. They work by constricting blood vessels in your nasal passages. That's how they reduce congestion. But the problem is, they don't just constrict vessels in your nose. They constrict vessels everywhere, including the ones that supply your heart. And in someone who already has high blood pressure, this can trigger a sudden, dangerous spike. A spike that can strain the heart wall, trigger chest pain, angina, or in the worst cases,
lead to a full heart attack.
I've had patients come to me after what they described as just a bad cold. They took something for congestion, their blood pressure spiked, and they ended up needing emergency surgery. If you have hypertension, heart disease, or a history of stroke, please read every label before taking cold medication. There are safer options. Saline nasal sprays, steam inhalation, ways to relieve congestion without affecting your blood pressure at all. Now this is where things become truly serious, and I need you to pay very close attention. We've talked about 5 medications. Each one carries its own risk. But what happens when you take 2 of them, or 3, at the same time? This is called polypharmacy,
And it is one of the most overlooked dangers in modern medicine for people over 60.
Let me paint you a real picture. A 72-year-old woman. She takes ibuprofen for arthritis, an antidepressant for low mood, and sometimes Benadryl to help her sleep. 3 medications, each one taken for a valid reason. But together, ibuprofen raises her blood pressure. The antidepressant interferes with her heart rhythm. Benadryl makes that electrical instability worse and increases her heart rate at night. Her cardiovascular system is being attacked from 3 different directions at the same time, and no one is connecting the dots. This is not rare. I see variations of this every single week. Drug interactions are not always obvious. Even experienced doctors can miss them. That's why something called a medication review is so important after 60. A doctor or pharmacist looking at everything you take, together. So let me ask you something simple. Do you know
Every single medication you are taking right now,
including over-the-counter pills, supplements, vitamins? If your answer isn't immediately yes, that's your first warning sign. I know this has been a lot, and I don't want you to leave this video feeling scared and powerless. That's not why I'm here. So let me give you something practical. Start with this. Write down every medication you take, every prescription, every over-the-counter pill, every supplement. Put it all on one piece of paper. That single page might become the most important health tool you have. Next, ask for a medication review. Many pharmacists offer this for free. A good pharmacist will go through your list and identify dangerous combinations. Don't wait for your doctor to suggest it. Ask for it yourself. And the next time you see your doctor, say these exact words. I'd like to review whether all of my current medications are still appropriate for my age and my heart. A good doctor will welcome that question. And one more thing. Never stop a prescription medication on your own. Any changes should be made under medical supervision. You are not powerless here. You are an active participant in your own health. And the more informed you are, the better decisions you and your doctor can make together. I've been a cardiothoracic surgeon for over 20 years. I've held a beating human heart in my hands. I've repaired arteries no wider than a pencil. I've stood in operating rooms at 2 a.m. trying to save someone who had no idea they were in danger. And here's the truth I can't stop thinking about. Most of the cardiac emergencies I see in patients over 60 are preventable. Not all, but most. A heart attack after years of daily ibuprofen. A stroke triggered by a sudden spike in blood pressure from cold medicine. A fatal arrhythmia in a patient who had been taking the same antidepressant for 15 years without a single heart check. These were not random. They were not inevitable. They were the result of a gap between what was prescribed and what was actually safe for that person at that age. And the hardest part? Most of these patients did everything they were told. They weren't careless. They were responsible. They just didn't have the information. And that gap is exactly why I make these videos. Not to replace your doctor, not to scare you into throwing away your medications, but because I truly believe an informed patient is a protected patient. Your heart has worked for you every second of your life, every beat, without rest, without asking. The least we can do is pay attention to what we put into the body that surrounds it. Because the next patient on my operating table doesn't have to be you. 5 medications. 5 real risks. NSAIDs, like ibuprofen, raise blood pressure and increase clot risk. Older diabetes drugs can cause dangerous drops in blood sugar and arrhythmias. Antidepressants can interfere with heart rhythm. First-generation antihistamines can disrupt electrical activity of the heart. Decongestants can sharply raise blood pressure. And when 2 or 3 of them are combined, the risk doesn't add up. It multiplies. Before you leave this video, do one thing. Write down every medication you take. Every single one. Take that list to your next doctor's visit. That one piece of paper could change everything. If you or someone you love has ever experienced an unexpected reaction to medication, leave a comment below. I read them, and your story might help someone else recognize a warning sign they would have otherwise missed. If this video gave you value, share it with someone over 60. A parent, a spouse, a friend, someone who takes medications every day and has never questioned what's really happening inside their body. That share might be the most important thing you do today. If you want to keep learning how to protect your heart as you age, subscribe. Because next week, we're talking about 5 symptoms that don't look like a heart attack, but actually are. You made it this far. That tells me one thing. You take your health seriously. Good. Keep going. Your heart is worth fighting for. And so are you. Everything shared today is based on current cardiology research and my clinical experience. But this is general information, not personal medical advice. Every person is different. Before making any changes to your medications, please consult your doctor or pharmacist. They know your full medical history. I don't. And that context matters more than anything I can say here.